Hi, this is Tanya from SUNY Downstate. This is a video to provide you with information about what is COVID-19 so that you can stay safe and healthy during this pandemic. So let's first talk about what is COVID-19. COVID-19, which is a short name for the coronavirus disease 2019, is a severe respiratory disease. And when I say respiratory, I'm talking about affecting that part of our body that helps us breathe, like our lungs and all of the other sort of aspects of our respiratory system. This particular disease was first detected at the end of December 2019. It is highly contagious and is now spreading quickly through our community. How is it spread? It's mainly spread by person to person. And this is with individuals with whom you have close contact, meaning that you are closer than 6 feet. What happens is when someone has the COVID virus, they might cough or sneeze. And when they cough or sneeze, there are these respiratory droplets that float in the air, and they get into our nose, or we breathe it in through our nose and through our mouth. We can also get COVID-19 if we touch surfaces or objects that also have the virus on it. These are public surfaces, but these can also be surfaces within your home. And when we touch these surfaces or objects, we might then get the virus by then putting our unwashed hands on our mouths, our nose, and in our eyes. Often, a lot of people ask, well, can someone spread the virus without being sick? And the truth is yes. That person is what we call asymptomatic, that they're not showing any signs, but that doesn't mean that they don't have the virus. So we have to be really vigilant in terms of protecting ourselves and staying away from people, whether they're sick or not. But the truth is, those individuals who are sick are probably the most contagious. And so we absolutely need to stay away from those individuals. What are the symptoms? So the most common symptoms include 3. A fever or prolonged fever that is at least 100.4 or above, and this is usually for several days. A dry cough and shortness of breath. Remember, this is a respiratory infection. And these symptoms usually start to show between 2 and 14 days after you've been exposed or you've had contact with someone who has the virus. I want to just say something. I know that everyone is afraid and anxious. I am there with you as well. But the truth is, 80% of the people who have COVID-19 are only going to have mild or moderate symptoms, and they will recover. And they can recover at home, okay? The people who are most at risk of exposure to COVID-19 are our heroic health workers, our doctors, our nurses, our pulmonary specialists, our PAs, our respiratory therapists. These are the individuals at the front line, and they have more exposure to COVID-19, and therefore they are more at risk. Individuals who are also at high risk are the police, the fire department, and our emergency responders, who are also at extreme risk. There's one last group that I want to identify that is also at risk, and those are our also heroic store and pharmacy clerks who are keeping their businesses open so that we can get food and our medicine. And they are also at high risk. And we need to be very grateful and thankful for these people doing this wonderful service. But there is about 20 to 15% of us who are at risk of severe disease if we should get COVID-19. And those groups include anyone who's over the age of 65, and this is just because our immune system starts to naturally decline after we get 65. But also, you can be very fit and take care of yourself, and that will help to protect you. That is, if you don't also have chronic health problems. These are the things that are actually putting most individuals at risk. And those include if you have heart disease, if you have lung disease, which can include COPD, emphysema, asthma, which I have, bronchitis, etc. Anyone who has a weakened immune system is also at risk. So if you've had cancer or you currently have cancer, if you have HIV infection, if you have lupus or any autoimmune diseases, you're also at risk and you need to take care. Finally, we've noticed that individuals who have diabetes, high blood pressure, also have an increased risk. We know that diabetes in particular also affects our immune system. Finally, there's some lifestyle things that unfortunately are placing people at risk. And one obvious one is smoking. So if you smoke, please try to reduce or try to stop smoking. This is not going to last for a week or two. And so you need to think about really minimizing your risk. That also includes individuals who vape. And finally, we're starting to see that obesity may also increase risk. How can I protect myself? So first, we really need to avoid contact, close contact with sick people. So if someone in your house gets sick, you really need to have them go to their room and stay there until they are better. First and foremost, if someone's sick, stay away. We need to wash our hands. I know it sounds really simple, but this is the best way to protect yourself and others, is to wash your hands, best with soap and water, and you want to really rub your hands, rub in between your digits, rub your wrists, everywhere. And the rubbing is actually the thing that helps to get rid of the virus. If you don't have access to soap and water at that particular moment, you can also use hand sanitizer that has at least 60% alcohol base in it. Again, we need to avoid touching our face, our eyes, our nose, our mouths when our hands are not washed. And finally, we need to clean and disinfect frequently. This is in our home, those frequently touched areas and objects, especially if we live with a lot of people. If you should feel sick, let me first say and remind you that this is also allergy season, and that there are also just normal colds going around, and the flu is also going around. Coronavirus is not the flu, and it's not a normal cold. This is something very different. So what we are advising is that everyone stay home. You stay home and you monitor and treat your symptoms. Going in to see a doctor, going into an urgent care facility, and especially going to an emergency room right now places you at risk of getting COVID-19. So you want to stay home, monitor your symptoms, and treat them at home. You also want to call your doctor, especially if you have any chronic ailments, so that you can get further advice on how to take care of yourself. So if you have diabetes, you want to make sure that you control your diabetes while you're also taking care of your cold. If you are by yourself or live with a lot of people, you always want to cover your cough. You cover your cough not with your hand, but maybe your elbow or a tissue, and please throw those tissues in the trash so someone else doesn't pick them up and gets the COVID virus. We now recommend that you wear a face mask or a cloth face covering. This is whenever you go outside. If you are feeling sick, you should wear it to protect others. If someone is going to help take care of you, you should ask them to wear it as well. All of these efforts are going to reduce the spread of the virus to others in our community. But when do you seek medical attention? And this is very important. There are some real emergency signs that you should look out for, and you should have a conversation with your doctor about maybe additional signs if you have any of these chronic ailments. But what we know is that if you have extreme difficulty breathing, that is a problem. If you have persistent pain or pressure in your chest, if you have confusion, if you seem just a little bit out of it, if someone sort of says, I was trying to wake you up for 10 minutes, And if you also have bluish lips or sort of a bluing sort of pallor in your face, this might mean that you're not getting enough oxygen and signals that you should get help immediately. Okay? But we're asking everyone to please call ahead first. And the reason why is that there are a number of hospitals that are designated as COVID only sites, and then there are other hospitals that are not. And so if you call your local hospital or ER, you need to figure out if that's the place that you should go. Our governor is moving around resources daily, and there might be a hospital closer to you, but the one that actually has the resources might be in another location. And so you need to figure out first where you're going to go. If you need medical help, regardless of your immigration status or your ability to pay, you call 311 or 844 NYC for NYC, and emergency responders will come. Okay? Please tell the dispatch, the person that you're talking to on the phone when you call for emergency help, that you think that you have COVID-19 so that they can come with a mask to protect themselves. And if you are able to put on a mask yourself before you are picked up, that will also help to protect the emergency responders. There is no vaccine for this particular virus. I know a lot of people have said it's like the flu, but we've been dealing with the flu for over 500 years. We have a flu vaccine. This is a new virus, and we do not have a vaccine now. There is no treatment for this. Nothing that it definitively will help cure COVID-19. But you need to call your doctor or downstate telemedicine to get more information about how you can protect yourself. This is New York City's coronavirus hotline number, 1-888-364-3065. And this is the number for SUNY Downstate Telemedicine, so that you can call if you are one of our patients. You can call and we can help advise you the best that we can, understanding your particular medical health needs. Please stay safe and healthy. Thank you.